Hi there. My name is Eileen Sullivan-Marx, and I'm a nurse, and I have a PhD, and I'm Dean of the Rory Meyers College of Nursing and president of an organization called the American Academy of Nursing, which is a national organization for nurse leaders. I'm so happy to be with you today, and I'm pleased to be here as your teacher's aunt. And happy to get to know all of you. Your questions were terrific, and I hope that I can answer them in a way that you will find helpful. It's so important for you all at this time to pay attention to what's going on around you, because as one of you said, you've never been through a pandemic before. Well, not many of us have, and I haven't either. The last pandemic like this that we had was in 1918, and I remember my grandparents talking about it, but certainly never experienced anything like this. Although when I was a child, poliomyelitis was a very contagious disease that went around, and it affected children, making them sick and making them sometimes unable to walk or breathe. And it was a disease that spread in water. And I remember summers where we were told we couldn't go swimming. And I think you're probably feeling some of those sort of things today. So let me get your questions. The first one's from Samara. If you had the coronavirus and are healed from it, could you get it again? Kind of like the chickenpox. Well, you mean that once you get the chickenpox, you have it for life. We think that is the case with the COVID-19 disease so far, but we need more time to know it for sure. If you recall, a few years ago, we had an Ebola outbreak, which is one of hemorrhagic diseases and hemorrhagic fevers. And they come in various ways. The last Ebola disease, once you had it, that was it. And you might remember that people who survived Ebola then became the caretakers of other people. So for this current COVID-19 is the disease, is what we call it. We think that's the case, but time will tell. Second question from Noah. Why do they tell healthy people who are not treating patients to not wear a face mask? So if you're healthy and you're not in touch with other people who are actively identified with a disease, the best way to prevent the spread of the disease is with distance, in other words, 6 feet apart, you've heard that, and with hand washing, and not touching your face. And after you do touch your face, wash your hands again. So that is the way that we prevent it. If you have the disease or you have the contagion in you, and you cough in the air, it might spread within the droplets for about 6 feet. So masks are something that we need to preserve right now for use in the best way, and they're not necessary. If you get sick with the disease, you should put on a mask to protect other people. But if you don't have the disease, you don't need a mask. Thanks for that question. Number 3, from Jonathan. How long can the coronavirus last on a surface before dying? That's a great question. And we don't really have the answer. You might have tried to look it up on the Center for Disease Control website, cdc.gov, which has frequently asked questions, and you won't find a straight answer because we don't know. When they looked at the cruise ship, the Princess cruise ship, and tested the surfaces, they did find evidence of virus after so many days, weeks in fact. However, we don't know if the fact that the virus was on the surface meant that you could get it from touching that surface. We don't know if that occurs by touching surfaces, but we want to be cautious, and that's why you hear things like wash down surfaces in your home every day, particularly if you have been in contact with someone with coronavirus. or with the COVID-19 disease. So that's the difference. We don't know how long it stays on the surface. We do know that it's active coming out of your nose and mouth. From Katie, does anyone have an idea when COVID-19 will be gone or when we will be released from quarantine? You know, one of the things that always happens in a crisis or in emergency preparedness, we use different words and terms, and they have definitions that mean different things. If you're in emergency preparedness or a health professional, quarantine, self-isolation, stay at home, shelter in place, all have clear definitions. And we tend to use these very in an informal way when they actually mean a particular thing. So let me run by a couple of definitions so you can understand them and check them out. Coronavirus is the virus itself. It is what we identify. It's related to the SARS virus, and but the coronavirus is not the disease. If you have the coronavirus in you and it turns into a disease, we call it COVID-19. You may have also heard it referred to as novel coronavirus, which means that we've never seen this particular coronavirus, SARS type, appear before, SARS type 2. So COVID-19 is a manifestation of the disease, while coronavirus is the virus itself as you look at it under a microscope in a lab. So your question is, when is this going to be over? It's a great question. Everyone's asking it. The best answer is to look at how many new cases and how long cases stay in a particular area. So the only information we have on that to date is what occurred in Asia, particularly in China and Wuhan province. So you may have heard some news reports that right now from Hubei province in Wuhan city that they have not been getting any new cases. The first new case was identified, we think, in late December in China and was more evident in January. And saw its beginning really with the lunar year and recommendations at that time for people in China to stop traveling. So if you just count January, February, March, so that's 3 to 4 months, and now there's no more cases. So that's the best estimate we have right now to say in the New York, New Jersey, Pennsylvania area, how long is this going to last? Well, we think we saw the first cases in February, and I say think because we weren't doing testing ahead of time. So I count February, March, April, May, and we now know, though, that we have a severe concentration in New York City. So it might go into June. That is, if the virus stays the same and if we social distance ourselves and we keep all of the precautions the same so it doesn't spread. So in the New York City area, we might see some change and relief of this by June, July. However, what we could see is continued outbreaks outside of New York City. So you can follow the U.S. map and see in the reports every night where you have increased cases in Florida, increased cases in Michigan, increased cases in Chicago. So if that's just starting there now, that's going to push it farther. So use about 4 months right now because that's the best information we have from China. This lasts about 4 months. But don't hold me to that because it could be longer. It certainly is not going to be shorter. And Katie goes on to understand, well, what does that mean for the school year? Well, as a dean of a school, this is a question I have. But we are preparing in the fall for classes to be resumed. We think that's what will be happening. What happens if there aren't enough hospital beds or ventilators for everybody? That's a sad thing to consider, and why you hear such a call governors of states to get the amount of hospital beds that they need. And what I've said is our capacity at the federal government with federal United States Public Health Service Corps, which is a corps of individuals who are health professionals. There's also a disaster management team of volunteers, but who are medical professionals who can be sent to places in the United States to care for people in disasters, and the United States military. So usually we don't like to use the United States military for things within the country unless it's for defense of the country. But in some ways this is the defense of the country. So that we see now building in the Jacob Javits Convention Center in New York City, the National Guard and the Army building a 1,000-bed hospital. You see the release of Navy ships going to the coast of California and New York. These are very large hospital ships that dock in port but have a large number of beds in them. What we have to look at when we're looking at number of hospital beds is the number of cases and how quickly people recover to go home so that we can then use the beds again. And but we're seeing in Italy right now, for example, that they haven't been able to keep up with that. So people are not in what you would call a typical hospital bed, but might be sitting in chairs or on cots or temporary beds in hallways. I have certainly seen that as an emergency room nurse in the past, where I have had so many people come into the emergency room at once for any number of reasons. And I only had a limited number of beds or stretchers. And what we have to do is then move people into hallways or into waiting areas on stretchers to be cared for. And those are usually temporary situations. But that is why you hear that we need more hospital beds and more ventilators. So, is anyone close to finding a cure? Well, I know that all the research at New York University and many other universities has been stopped except for COVID-19 research. So from the beginning of the work in China, there has been work in laboratories to try and find what you call a cure. The cure is really a vaccine, meaning that you give a vaccine like chickenpox and measles, and then you're immune from getting the disease. And enough people being immune means the disease can't spread. There are, however, a few medications or drugs that have been found to be effective, but they are mostly being studied and have some limited effect. And there is work going on both at the Center for Disease Control, the National Institute of Health in Bethesda, Maryland, and the University of Nebraska that have been looking at treatment, particularly for a number of the people who were infected coming off the cruise ship, because they have volunteered themselves to be studied. Once they got better, what helped them to get better? And Katie apologizes for all of her questions, but that's terrific. The more questions, the better. Caitlin wants to know, is there any virus can end if there's no cure? So if there's no vaccine and there's no cure, that's a great question. Viruses sometimes just stop. Every year, you've heard about the flu season, and there are influenzas that go around the world and spread. But once people leave homes and aren't coughing on one another in the wintertime, it kind of just goes away. In fact, some viruses go away after they spread more, because as it spreads from person to person to person to person, it gets weaker itself as a virus. This particular virus, because it is new to the human species has never seen this before. This particular one is not showing signs that it's dying out. We had hope for that, of course we always do, but it doesn't seem to be that way. In 1918, the epidemic that was caused by an influenza virus at that time as well, went away, but came back a few months later. And so we want to have a vaccine so that this doesn't happen. Vaccines, as some of you have asked, do take a long time to develop, particularly for ones that are brand new. So it'll take 12 months to a year and a half before we have a vaccine. But you can all look forward to that and think of yourselves as being among the first generation who will eventually get the vaccine to this virus. So Owen wants to know, why is it that some people are not feeling symptoms compared to others who are feeling the symptoms? Another great question. So for some reason, the time that we have this virus, so if this virus enters my system, I may not start to feel symptoms for several weeks. We think it's about 14 days by doing the research that was done in China. Usually with catching a cold, you know that you might, feel like something's coming on, but you may have been holding the cold. Colds, by the way, are also a type of coronavirus. You realize that you may have passed it on to other people the day before, but you didn't quite feel sick yet. Same thing for this particular coronavirus. It's in your system, but for some reason, with this particular virus, it's there for several weeks before we pass it on. It may be that some people's bodies and immune fighting system is stronger than others and simply passes it away. Others get tiny doses and have a response. Others get larger doses and have a higher response. Luciano, for every person infected, how many people do they infect? Well, I think we'll know more about that after we finish this disease. Unlike some diseases like typhoid fever or cholera or food-borne diseases, where if somebody eats something bad out of a batch of food in a grocery store, you can go and count, oh, this one ate this bad vegetable, and this many people had the bad vegetable, and this many people, and then you count because it spread. This goes, into the air. Anyone who comes into contact within 3 to 6 feet of the droplets being spit out of an infected person to someone else will probably pick up the virus. So it's hard to say how well it spreads. The spread will depend on how close we all are. So the number of people who get it will depend on how many people are within 3 to 6 feet of you if you have the disease. Hence, let's make sure everyone stays farther apart and doesn't sit on top of one another for this time period. Owen, I think I answered the question, why don't you feel the symptoms and others do? And why do some people get so very ill with it and others don't? Probably has to do with being able to fight it off. And also, if you already have health problems, and I mean health problems in which you have, you're seriously ill, it makes it much harder to fight it off. And therefore, that's why you're seeing that people who have chronic illnesses, most of whom are older, because as we age, we accumulate all these other diseases. It's not so much that you're just old, but you're old with other diseases that makes it hard for you to fight off the coronavirus. And Mr. Marx wants to know, how do the challenges of the coronavirus outbreak compare to that of the Ebola outbreak? Well, the Ebola outbreak was a much worse mortality. It had a mortality between 40 and 50% of people who caught it died. And you could die, you could get the disease very easily from simply touching the person. A light touch could do it, or touching clothes that the person wore, because the Ebola virus was in our sweat, in our saliva, in your eye drops, in your blood, everywhere. And so touching anything that the person touched became a problem, and that had a 40 to 50% rate of death if you caught the disease. So that, to me, was a much scarier disease. The coronavirus has a much lower mortality. The mortality rate is 1, 2, or 3% among the general population. Among people over the age of 80, however, 15% of people who've been getting the coronavirus die. So that's the difference between the two. Coronavirus spreads in contact pretty quickly. A lot of people pick it up. However, the Ebola outbreak is a much more deadly outbreak. So, Mrs. Froehlich wants to know, why doesn't coronavirus impact children as much? No one knows the answer to that question. I wouldn't say that no children are infected. There's only been a few who manifest serious symptoms, serious illness, and there have been reports of some children passing away. However, it's much less, as I just said, and maybe in children even less than the regular flu that you get. We don't know why. Is it perhaps that young people have new and strong systems of fighting? Your immunosystem, which fights off disease, is very strong. And so your body says, get out of here. It may be that the virus passes through young people faster. You get it and it flushes out of your system much faster than it does in older people. But we don't know. It's been one of the great curiosities of this particular disease. But it doesn't mean that younger people are not a part of the disease, because anyone who's, regardless of their age, who's been with someone with the virus and picks it up can spread it. So you all are going to be the champions of social distancing. It's a way that you can tell your parents what to do, and tell your grandparents what to do, and tell your teachers what to do. You didn't wash your hands after touching your face. You need to do social distancing. Speak up and be the champions for social distancing and hand washing. And I'm happy to answer more questions at another time. And thanks, Mr. Marx, for inviting me to be here today. Take care, everybody.